arm, it develops and forms new blood vessels and skin. Once it is fully developed, the new ear is removed from your arm. The new blood vessels are attached to your ear hole, and the skin is carefully stitched to your head, giving you a new ear.
A very nice animation actually. I liked how that ear was totally cut, sliced with the sword that just fell. Hey friends, Dr. Bob here, ENT surgeon based in India, and today let's react to all the Zack D Films, focusing more on the medical animations that he has made. Let's see about how accurate these scenes are and how well they're portrayed. So let's get into it.
When a wound gets stapled, a doctor holds the edges of the area shut to ensure that they're aligned with each other. Then they use a tool to apply surgical staples across the area. Unlike stitches, this method allows the doctor to quickly close the wound and is often less painful. Once they're all in place, the wound begins to heal, and after a few weeks, the staples are removed.
Very well portrayed, it's nice, and it's good, I liked it. But there's a small suggestion. Well, basically what you do is you use a non-dominant hand. Like, your dominant hand is for stapling. Your non-dominant hand you use a forceps. So you like suppose the skin is obviously open, so you use the forceps, approximate with the forceps, and once it's done, and we use a staple and staple over it. And as the video showed, fingers, we don't use fingers to approximate, we use forceps. That's more of more sterile way to do. And I see here there is no usage of gloves, which was required because obviously to maintain sterility, which was not there. So again, unsterile way of doing staple suturing. And the materials can be either titanium and stainless steel materials are there for the staples. And the advantage is that obviously it's a faster way to do than sit and suture. But instead of that, we can just tuck staples we can put and close. And obviously there's consistent approximation and lesser chance of infection. But the problem and the downside is that there will always be a mark of that staple, which will be the more chances of marks, which is less seen if you do a normal suture which you take. Another thing is that you can't use it for delicate skin areas like your face or above your eyes, etc. It can't be used. And obviously in the end, to remove them, you require a staple remover, which is not painful as how it sounds like, but yeah, without the staple remover, it'll be difficult to remove the staples which you have put. Overall, I would rate this 5 out of 10, mainly because of the unsterility which I saw. Otherwise, this would have got a better rating.
If your ear gets ripped off, you can actually take some cartilage from your rib cage. Then a doctor will carve it into the shape of an ear and place it into a pocket of skin on your forearm. Inside your arm, it develops and forms new blood vessels and skin. Once it is fully developed, the new ear is removed from your arm. The new blood vessels are attached to your ear hole, and the skin is carefully stitched to your head, giving you a new ear.
A very nice animation actually. I liked how that ear was totally cut, sliced with the sword that just fell. Well, talking about medical point of view, this is something where autoplasty is called as. So basically in the 1980s to 2000, this concept was brought by Nagat and Brent, where they do use the bone, the autologous cartilage or the bone, basically the rib cartilage is used. Well, in this concept, what they used was the rib where they shaped in the form of a ear, and it took 2-3 sittings to do this. Whereas nowadays it's all skipped because we can use the MedPer, which we have as alloplast implant, which is used. So with that, it can do a job of, instead of approaching the ribs to get the bone and carving it, this itself we can place, and after placing it we use a temporoparatal flap, skin grafting, we keep it in place, and that's itself as a one sitting surgery. We can fix if the patient is having no ears, a situation where it's a congenital disorder where the baby is born with no ears, so this something can be done. So I would give this 7 out of 10.
The skin is carefully cut from your forehead, and this forehead flap stays attached to a blood vessel to keep it alive. It's then folded down to cover the hole in your nose where the skin cancer was removed. It's attached in place with stitches, and your forehead is sewn back together. Over the next few weeks, the skin begins to heal with the blood vessel feeding it nutrients. And once it's strong enough, it's cut away from your forehead, leaving you with a brand new nose.
Yep, correct. Very well shown. Basically, that's the forehead flap that's used, and the blood vessel they're talking about is a supratrochlear artery, which is coming from the ophthalmic branch. So the cases were coming with squamous cell carcinoma, basal cell carcinoma, present of the nose, tip, etc. In this region, what they do is excise whatever is there, and the defect is closed with the forehead flap that's taken, rotated, and kept. So it's rotated and kept, right? So after we need to keep it for weeks together for the vascularity to take place. So once its adequate vascularity is seen, so that's where after we have kept it, we divide the flap which was rotated and we suture it back. It's not that we cut the vascularity what was there, because the video shows like it kind of portrays like that, but we are just dividing the part which we rotated and suture it back in place for aesthetic purposes. And yeah, otherwise in whole the video was made really well, like the animation. I would give this 8 out of 10. So if you're watching till here, you liked all the animation videos brought by Zack D, and if you found something informative from this video, do show some love for our channel and do leave a like and subscribe for more.
A doctor can stick a curved tube up your nose and push it into your sinus cavity if you are chronically blocked. Then a tiny balloon is guided through the tube and into the blocked area. Once positioned, it's gently inflated, which expands the sinus passageways, reshapes the inner walls, and clears up the blockage. And after a few minutes, the balloon is deflated and removed, leaving your sinuses open.
Beautiful.
Oh my god! Wow!
I liked it. Nicely portrayed. That's basically called as a balloon sinuplasty, which is defined as where it's a very minimally invasive procedure. This tube goes through the sinus opening, which is the maxillary sinus opening, frontal sinus, ethmoid, like that. So once the tube is gone beyond, we inflate the area with the balloon so that opening of the sinuses is enlarged. Following that, whatever secretions, collections are there, that all can come out and giving a relief to the patient. So this is not done to everyone that comes. It's something where you're chronically having this condition and it is not reducing even after using medications and nasal sprays. So then we can think about balloon sinuplasty. So it's more like an OPD procedure done with minimal local anesthesia that's required. And within that, within a period of 24 hours, they can go back to work. So for this one, overall, I'll give it a rating of 9 out of 10.
This nose job begins with a surgeon making a small incision across the bottom of the nose. This is so the skin can be peeled back, exposing the bone and cartilage. The goal of this specific procedure is to reduce the hump on the bridge of the nose. The bone and cartilage are carefully shaved down, reshaping it into a smoother, straighter bridge. Once they're finished, the skin is draped over the new bridge and the incisions are stitched up.
What? So many incisions like that. Not required. I mean, for animation purpose, yeah. But otherwise, you don't require that many incisions. Otherwise, you don't require that many sutures. So as the video showed, it was rhinoplasty, more towards reduction rhinoplasty because of the hump that the patient had. And the flaw which I found here is more likely the incision which was taken, which was supposed to be like an incision which is not a straight line. It'll either be a V, inverted V, step ladder, W, like there are many other incisions like that, but it's not like we take an incision right straight cut. And yeah, the rest of the procedure done was actually nice and well portrayed. They've even used the rasp, the nasal rasp, which is done for reduction of the hump, very nicely and properly portrayed. So for this I will give 9 out of 10. mainly because of the wrong incision.
When you break your nose, the nasal bones shift out of place, making it hard to breathe and changing the way you look. To realign it, a doctor will gently push the bones and cartilage back into the right position. Then the nose is packed with gauze, and an external splint is sometimes worn, holding everything together to heal.
Yep, good. That also goes towards nasal trauma correction. Overall, everything was nice, only for the fact that you don't directly manually adjust the broken nasal bones and the septum, whichever is there, because there are designated instruments for that, which is called as the Wellstrom forceps and the Ash forceps. So what we use is this Ash forceps if there's mainly focusing in the septum region between, and the Wellstrom forceps mainly focusing on the lateral side. I would be more happy if they mentioned about the forceps and that was something that you helped to reposition the fractured parts. But overall, to what they've done, it's not like a big blunder that I'm picking it out, but otherwise it's overall good animation that he's done. So missing the instruments, I think I'll give this clip 6 out of 10.
A doctor can make an incision on your neck if you can't breathe, carefully cutting all the way through the skin and fat underneath. They'll move and reposition the thin muscles and connective tissue that surround your windpipe. And finally, they make an incision in your trachea and insert a breathing tube. This causes the air to bypass your blocked throat, allowing you to breathe.
Yep, very well shown. Tracheostomy basically, but you don't require this big of an incision. The video shows like from here till here, this much is cut open and it's open like that. No, that much of big incision is not required. We go for minimal incision that's adequate enough to reach the airway. What we usually do is a horizontal incision to like 2 finger. So basically this 2 finger distance we take from this prominence of this bone here. So from here we take 2 finger distance, and after that we take an incision, like a horizontal incision, which is barely probably like 3-4 centimeter. That's enough. This much is enough. With that incision we go dissect with the forceps. After that, once we reach trachea, again an incision to the trachea. After the trachea is open, we insert the tube. And one thing I noticed is that the tracheostomy tube, the horizontal part stays like this, whereas in the video it showed vertical. So that's also a correction which I would say. And apart from that, everything is good. It shows the basic idea how tracheostomy is done. Well, you don't require this much medical dissection into videos like this, because it's not wrong or it's not a blunder as such, which I'm finding. It's just those minimal corrections which is there, which is meant to happen if non-medical people are in the field of making animated videos. So it's okay, just a piece of suggestions from my side. So for those small things here and there, I think I'll give it 8 out of 10. So in whole, I respect and love Zack D and his team for producing such amazing, informative medical videos, and obviously he's known for his traumatizing videos out there, which I'm not putting it up here because I wanted to connect something medically here with his work. So if you want part 2 of this, do let me know. I'll be more than happy to make for that. And in whole, as I said, the animations are great. It is not that I'm finding mistakes, it's just that it's just my medical point of view and giving a constructive feedback for it. So in whole, it's great. I hope he keeps producing more videos out like this, and he's already doing a great work, and keep it up. So that's all for today, my friends. I hope you guys liked today's video, and if you guys liked it, don't forget to leave a like and share this video with your friends out there, and subscribe to the channel. And as always, you guys take care, stay safe. This is Dr. Bob signing out.